Right, hello everyone. I think that's about 4:30. Thank you so much for all joining us this afternoon. I'm Alex from the British Nutrition Foundation, and today I'm joined by my colleague Francis, also from the British Nutrition Foundation. And today we're going to be presenting about adverse reactions to food and the management of allergens in the classroom. Now I'm going to start and tackle the first part of that title, the adverse reactions to food. And then Francis is going to be looking at the management of allergens in the classroom. So first of all, before we start, just a little bit of housekeeping. So this webinar is being recorded and will be available on foodeffectivelife.org.uk and also on our YouTube channel, which I encourage you all to subscribe to, Food Effective Life. I've seen lots of people in the chat box already, which is fantastic. But if you do have any questions, please type them into the chat box. And if you want other people to see your questions, then just make sure that the little arrow box above where you're typing your question is set to all panelists and attendees. And that means that not just me and Francis can see your questions, but everyone can see them. And if you've got answers to people's questions, then you can put them in there as well. So at the end of the webinar, you'll be redirected to a short online evaluation and downloadable certificate. Just one point here, if you are watching this in the future on YouTube, if you're watching the recording, then unfortunately, we aren't able to provide you with a certificate. Certificates are only provided for those who are able to attend the webinar live. So that's everything for housekeeping. So let's begin. So I'm going to start by talking about adverse reactions to food. So the first thing I'm going to tackle is, well, actually, how many people is this affecting? So how many people have adverse reactions to food? And really this falls under two main categories, food allergies and food intolerances. You can see from the left-hand side, this is according to a report from the Food Standards Agency, Food and You report. These are the most common foods that people are having adverse reaction to. And right at the top is cow's milk and cow's milk products. So things like lactose intolerance, cereals containing gluten, so it might be something like celiac disease, and then also mollusks, for example, mussels and oysters. And then on the right-hand side of the screen, you can see some figures from food.gov.uk about the number of people with food allergies. And there's two things that I really want to pull out from here. The first is, as you can see, the number of people with food allergies for adults is slightly lower, and this is because in some cases, children can grow out of allergies as they get older. And the second thing here is that actually this number is quite small compared with self-reported food allergies. So surveys suggest that rates of self-reported food allergies are as high as 15%, which is of course far higher than 1 to 2%. And this is a big thing for food allergies and intolerances, that a lot of people do self-report and don't seek medical advice and medical testing to see if they actually have food allergies and intolerances. So we're going to start by looking at the definition. So a food tolerance is difficulty digesting certain foods and having an unpleasant physical reaction to them. Now that's slightly different to an allergic reaction to a food, is an inappropriate reaction by the body's immune system to the ingestion of a food. And if we really pull out the differences from there, the first one is that bit about the immune system. So a food allergy is a reaction from the immune system. Food intolerance doesn't involve the immune system. So instead it can involve things like, as in the case of lactose intolerance, which we're going to look in a bit more detail later on, it's the absence of an enzyme and doesn't involve the immune system. Now the other difference is really around symptoms, and there's two parts to this. One is about the onset of the symptoms. So for a food allergy, these can come on rapidly after eating just a small amount of the food. For food intolerance, causes symptoms many hours after eating a reasonable amount of the problem food. And I think this is sort of what we can understand just from the things we see. So something like a peanut allergy, you might have, if you've been on an aeroplane or on some public transport, it's recommended that if there's someone on the flight who has a peanut allergy, they stop other people on the flight even having any peanuts on them. And that's because it's such a small amount of a peanut can cause a peanut allergy. Whereas with a food intolerance, it's usually is the case that people have to eat it. And in the case of lactose intolerance, again, actually, people who have lactose intolerance can actually eat some of the food, of dairy food containing lactose, and still not get symptoms. So there's a slight difference there, but also in the severity of the symptoms. So for a food allergy, it can be serious and life-threatening. And for a food intolerance, again, whilst no one would want to have a food intolerance and they can be extremely unpleasant symptoms, it tends to not be life-threatening, it tends to instead cause unpleasant symptoms. And the other main difference between the two is that food allergies are often triggered by specific foods. So we said about a peanut allergy, whereas a food intolerance can be caused by many different foods. So if we look into a bit more detail about a food intolerance, as we said, is a difficulty digesting certain foods, having an unpleasant physical reaction to them. Now, one thing I just wanted to draw out from here is that the symptoms, so bloating, stomach pain, diarrhea, things like that, can occur with other types of reactions to food. So things like food poisoning, but this is slightly different. Because rather than being caused by the food itself, it's from the bacteria or viruses or molds or things like that. A food intolerance also doesn't include food aversion. So by that, I mean, if you've had a food as a kid and not enjoyed it, or perhaps it's made you sick from food poisoning, and then subsequently you avoid this food and it makes you sick to think of eating it, whilst that might cause unpleasant symptoms, again, it's slightly different to a food intolerance. So how do we go about testing for a food intolerance? Well, we said about the importance to, if you've got a food allergy or a food intolerance, or you think you might do, doing any testing under the supervision of a medical professional. And by that, I mean a GP or a dietitian or someone like that. And the real way that food intolerance is tested for is what's known as an elimination diet. So this process starts with, alongside a dietitian or a GP, as I said, doing a food diary, and then they'll look at what might be the problem food. So it might be that when you finish your food diary, there's a significant amount of dairy foods, so lactose. There might also be foods containing gluten, as an example. So what then the dietitian would do is look at removing the foods that they think might be triggering this response for a few weeks. You've got the example here for 2 to 6 weeks, seeing if your symptoms improve. If they don't improve, then that's unlikely to be the suspected or problem food. They might move on to something else. If the symptoms do improve, then they gradually reintroduce the food to see if the symptoms return. And if they do, then the likelihood is that that's going to be the food that's been causing this food intolerance. So I've got an example here of lactose intolerance. And as we said previously, this is caused by the lack of an enzyme, that enzyme, being lactase in this example, which is needed to break down lactose. And it says here the sugar found in milks. That's why it's really dairy products that people with lactose intolerance try and either cut out, or if their symptoms aren't as severe, at least cut down on. And the reason why this causes illness is if the lactase levels are low, or if people don't have any lactase, and that's the enzyme, then the undigested lactose then can pass into the large intestine. That's where it can cause pain and cause diarrhea. Now, one of the interesting things about lactose intolerance is it's actually relatively uncommon in the UK. So in the UK and Ireland, it only affects around 5% of people. But in Africa and in Asia, it's much more common. And they're in places where dairy foods aren't as common in the diet. And in Africa and Asia, lactase deficiency can be as high as 100% in the population. So you can really see that massive difference between the levels in the UK and Ireland, and then in Africa and Asia as well. And we said previously that the people with lactose intolerance can often tolerate some dairy, so especially dairy foods that are low in lactose, that have low lactose levels. And one example of this is hard cheese. So it might be that if someone with lactose intolerance wants to include some dairy in their diet, that starting with hard cheese might be able to help with the symptoms. So I'm going to move on to talking about celiac disease, which again is slightly different to lactose intolerance and your food intolerances, because it's actually an autoimmune reaction to gluten. So what causes it is the body's immune system turning against itself. That's what an autoimmune reaction is. Now, there can be some confusion as to exactly what gluten is, but gluten's a protein that's found in some cereal products, so in wheat, barley, and rye. And how this causes illness is that the gluten damages the small intestine, so people are unable to absorb nutrients from the food as they normally would, and symptoms can be things like stomach pain and diarrhea. If you look at the middle bullet point here, which says celiac disease affects at least 1 in 100 people in the UK. However, only 30% of people who have the condition have been clinically diagnosed. Now, with celiac disease, this is interesting in 2 ways, because you've got the fact that there's a significant proportion of people who have it but aren't diagnosed. There's also a significant proportion of people who self-diagnose either celiac disease or an unpleasant reaction to gluten for another reason, and then cut out gluten from their diet. And there's also the fact that there's sort of this health fad at the moment to go gluten-free and to cut out food containing gluten. Now, there can be a few issues with this. The first of all is cutting out gluten tends to mean cutting out a significant proportion of, if we think of the Eat Well guide, of that potatoes, bread, rice, pasta, and starchy carbohydrates group, which can impact fiber intake. And we know that in the UK, adults are having on average 19 grams per day of fiber when the recommendation is 30 grams per day. So we're already seeing people far below the recommended fiber intakes. And there's also the point that if people cut out gluten, it's more difficult for your dietitian or your GP to clinically diagnose celiac disease. So they're the 2 real reasons there. So we've moved on to a food allergy. We've spoken a little bit about the definition and the fact that it can vary in severity and can be potentially fatal. And some examples of a food allergy: peanut allergy, milk allergy, an egg allergy, and things like that. And we'll talk a little bit about the importance of allergen labeling, and Francis will talk about how we can try and manage this in the classroom as well. Now, the thing that happens with an allergic reaction, if it is severe, it can lead to anaphylaxis, which involves several organs, and particularly the heart and the lungs. Now, as we said before, these symptoms can develop very quickly. If you're having a severe allergic reaction, or if you know someone who has a severe allergy, they'll be carrying around what's shown in the picture here, an EpiPen. Now, the reason that that's called an EpiPen is because to treat anaphylactic shock, you need to inject adrenaline, and another name for adrenaline is epinephrine. So that leads to it being an EpiPen. And then there's a few examples there of what can cause anaphylaxis and the common causes in the UK. Now, if you move on to food allergen labeling, these are the 14 most common food allergens in the UK. And by law, food and drink and ingredients containing these allergens need to be highlighted on the ingredients list. Now, this includes even if there's a chance of a minute amounts of an allergen. So an example could be if the food's being produced in the same factory as other ingredients known to cause an allergy, an additional statement is required. And examples of this could be also may contain soya and egg, may also contain nuts. So there's a voluntary statement that usually includes the word also in there as well. Now, there's been a new allergen labelling law that's going to come into force in summer 2021 due to the tragic story of Natasha, who is a young girl who had a baguette, an out of home outlet, had an allergic reaction to something in the baguette, and tragically passed away. This new legislation has been put into place to tighten the rules by requiring foods that are prepared for direct sale to carry a full list of ingredients on them. And again, that's really sort of the most recent update in terms of food allergen labeling that's going to come into play. And if anyone wants to read more about that, there's the information on the gov.uk website, and the link will be provided. So I'm now going to pass over to Francis, and I'll be in the chat box to answer any of your questions as well. So thank you very much.
That's great. Thanks, Alex. Hopefully everybody can hear me. There may be a little bit of delay in the slides because Alex is in his home and I'm in my home. So you just need to bear with us, please, just for a few minutes, just while we go through the slides. So what I'm going to be doing is thinking about managing allergens in the classroom. So Alex has explained that really well. And this is just thinking about the practicalities of it. And this is both the primary classroom and then also the secondary food room as well. But what I wanted to do first of all was really just talk about why good food hygiene and safety practices in school are important. And this is just a sort of a bit more of a general background before we move into allergen management. And probably the most important thing is to prevent adverse reactions to food. So for most people, you would think that might be food poisoning, but we also need to think about allergic and intolerant reactions. So that would be pupils, parents and staff. And those of you that may have heard me present on sort of food safety before will know that I used to feel that when I was teaching, that actually making sure that the food hygiene and the food safety within my classroom, my food room, was the most important part of my job, and making sure whatever I did and whatever the pupils did didn't cause any harm to anybody else. So I think that's probably the most important thing. But then there's also the teacher's own indemnity as part of due diligence. Now, due diligence means that the school, the staff have done everything possible to make sure that something doesn't happen. Unfortunately, sometimes things do, but if you've got steps in place to reduce the hazards and reduce the risks, then due diligence will help in the future if necessary. There's also greater emphasis on healthy eating and practical cookery in the curriculum, so therefore there's more possibility of issues happening around food hygiene and safety. And then also the other thing, this shouldn't be the sort of the main reason for doing it, but it is actually important to actually identify that the inspecting organisations around the UK all have some element of safety within their inspection guidance and their handbooks. So that is something to bear in mind. Right. Are we going to move on? There we go. Oh, too far. There we go. So food safety policies and risk assessments, why are these necessary? So risk assessments, probably when you walk into your food room or your classroom, if you're a primary teacher, you probably automatically do a risk assessment. It's something that comes naturally to teachers. But actually, a proper risk assessment is a formal activity, and you have to go through various stages in order to achieve that. And it's a written formal document. But we obviously do it as part of our everyday working lives as well. But risk assessments, interestingly, for around the UK, it's not actually a legal requirement for risk assessments to be done for food activities, which I always thought was quite surprising. However, it is very, very strongly advised. So risk assessments help to minimise the risks in practical work, and also the other thing is that they can help us focus on what we're actually doing, what the hazards might be, and then also how the risks can be prevented or reduced. As I said before as well, with the inspections, when you might have Ofsted coming in, for example, if the poor food hygiene, if the hygiene is poor, including allergen management, then that would actually be noticed and drawn to the school's attention, which would then be an issue for the school. But if you've got food safety policies and risk assessments, that would help to prevent that from happening. So risk assessments, so there are lots of generic risk assessments that are available. So you can get those through your local authority. We also have some on Food Effective Life, and if you're a member of CLEEPS, you can get them from CLEEPS or from CERC in Scotland. However, the most important thing is if you are getting risk assessments from an organisation, that you make sure that you, what they call adapt and adopt. So you don't just download them, put them in a file and say you've got a risk assessment. They have to be adapted so that they suit your setting and your school and your pupils. Otherwise, if something should happen and you say, I've got a risk assessment, and they have a look at it and it's not relevant to what you're doing, then that's when there can be problems for the school. So just very quickly, just thinking about the support that Food Effective Life can give about risk assessments. So we've got some resources for primary, so we've got some guides, and we've also got some exemplar risk assessments. And then we've got the same for secondary as well. So there's quite a list of resources that are available. And then as Alex said, that we're going to put this on Food Effective Life, the PowerPoint will be there as well. So if you want to have a look at any of these resources or click on any of the links, you'll be able to do that. You'll be able to see in the bottom corner that we also have some practical activity guidance for COVID. So if you're wanting to do tasting sessions or practical work, then you could perhaps have a look at that. And that's based on the guidance from around the UK and also from CLEAPS and CERC. So as part of due diligence, record keeping is absolutely essential. So there's lots of things you need to make sure that you keep up to date in your records folder. But the thing that's relevant for today is making sure that within your records, you have a list of pupils' special dietary requirements, especially allergies. So this is a bit of a thorny issue, and I thought it would be worth talking about today. So to ban or not to ban ingredients. So I know that this has been something that has been teachers' focus for a little while this year. And I know through various forums it's been discussed. And we did a bit of investigating earlier on in the year just to see what the advice was from different organisations around the UK. So we looked at the FAQs and the websites for Allergy UK, Anaphylaxis campaign, Department for Education, and also National Education Union. And they've all got information and support for schools around managing allergens. The thing that is particularly important, and the Department of Education, they really stress this, that pupils shouldn't be disadvantaged because of a medical condition. Now here we're talking about a diagnosed allergy. So Alex was talking about the difference perhaps between self-diagnosis and actual sort of formal diagnosis. But if a pupil in school has a formal diagnosis of an allergy, then, and particularly if it's one that would lead to anaphylaxis, they will have a care plan, and within that care plan it will give you some guidance as to what the pupils are able to do and what to do if there's an issue, if there's an emergency. But within the guidance from the Department for Education, they do stress that pupils, there shouldn't be barriers for pupils when they're taking part in activities at school. So they actually say pupils with medical conditions should be properly supported so that they have full access to education. So that might mean that within the school you have to think about the kind of recipes that you're doing, the kind of environment you've got, particularly finding out from the pupils and obviously the parents the hypersensitivity of the allergic child, just so that you can manage what you're doing with them and with the lessons. So the answer really, rather than to ban or not to ban, as far as all of the organisations, is to develop a culture of allergy awareness and an effective whole school management approach to allergens. And obviously this includes food and nutrition lessons. And from Allergy UK, there's guidance states that simply banning ingredients is not a risk-free solution. So schools need to find a way around it rather than just banning ingredients, because you may provide a completely nut-free, egg-free, dairy-free environment, but actually when the pupils actually go out with the school, it's not going to be nut-free or dairy-free or egg-free. So it's important that the whole school, all of the pupils, the teachers, the management, develop this culture of allergy awareness and effective management. Okay, so we'll talk about practicalities of that as we go along. So this document here, the characteristics of good practice in teaching food nutrition education in primary schools, you may well have come across this. We have a secondary version as well, and this sets out with it's a guide that we put together with lots of teachers around the UK, with Public Health England and with other organisations, Food Teachers Centre as well, Louise Davies, and thinking about what's good practice in teaching food and nutrition education. And part of it particularly is the practical application of managing allergens. So this one is for primary, and in practice, staff ensure provision has been made for pupils with food allergies, intolerances, and or other dietary requirements so they can participate safely in food activities. So that's exactly what I've been saying, is making sure that if you have a pupil in your class that has an allergy, that they can still take part, but it is done safely. So characteristic 5 of this particular guide is talking about sending an ingredient check letter home. Now, we do have examples of these on Food Effective Life if you'd like to see one, and I had the link a bit earlier on in the presentation. So send an ingredient check letter home to parents and carers to check for allergies and intolerances, but also it's a good idea, it's obviously not essential from the safety point of view, but also to find out any religious, cultural or other reasons why children may not be able to taste or handle food. Now, this should be done at the beginning of the school year, or if perhaps you might have a different activity, you might have a school visitor that's coming in that might be doing something different with the pupils, if you're going out maybe, and you might be going to a farm or you might be going on a restaurant trip. I know that's not something that we're perhaps doing at the moment, but hopefully will in the future. Then you need to be thinking about, is there going to be anything that you're going to be coming across when you're going out and about. So still with primary schools, it's important that staff check ingredient food labels to make sure that they don't contain the ingredients. So Alex listed the 14 allergens that need to be labelled, but the teacher would then need to check the food label against the list of pupils with allergies that they will have. So that would come from the ingredient check letter. And then also the other thing, and I know this is perhaps a bit difficult in primary, but to make sure that pupils are aware of the importance of not sharing ingredients or equipment with other pupils who they know or you know that have got allergies, because what we want to do is try and prevent cross-contamination. And then we move on to secondary, and very similar sort of things. So you need to establish procedures to ensure that learner and staff food allergies and tolerances are known. We've talked about pupils a lot, but actually we have to remember about staff and people that might be working in the food room, and you as teachers might have allergies. And actually, myself, when I was teaching, I've got an anaphylactic reaction to eggs. So I had to be very careful when I was cracking eggs for pupils, or I remember I used to have particular issues when year 8 all used to make quiche. So, so we had the cracking of the eggs, the mixing the eggs, wiping it up, and then if I got it onto my hands and I had a cut on my hand, I'd have a reaction. And also I used to find that actually there was, if there were 80 quiches being cooked in the oven, my face in particular used to react from the allergy being airborne. So it's not pupils, it's staff as well. So you also need to make sure that you're storing food containing allergenic ingredients separately. So if you've got a storeroom, ideally you would have plastic tubs with the allergenic ingredients in, with a really clear label on it saying exactly what's in it, so that you're not going to risk cross-contamination. And then also make sure equipment is used, cleaned and stored separately to prevent cross-contamination of allergens. Now here, it's important to think about if you have pupils in your classes with allergic reactions, or you are intolerant, it's finding out how hypersensitive they are, because some pupils may be absolutely fine using the equipment that everybody else has used and has washed up and put away, as long as it's washed up thoroughly. Whereas other pupils, if they're more hypersensitive, will have to have a separate area, will have to have separate equipment that's only used for them and perhaps just brought out for their lessons, and it needs to be stored separately, etc. So the key here really is to find out from the parents, the carers, and the pupil themselves exactly the level of their hypersensitivity. And I think that's a really important thing actually, is to work with parents to make sure, because they're the experts, unless perhaps the pupil, their child has been diagnosed fairly recently, they may be a little bit nervous and a bit unsure. But if they've lived with an allergenic child for a long time, they're the experts, they know what they can and can't do. But what I thought was quite interesting was I had a look at Coeliac UK's website today, and they've got some good advice for cooking at home. And I just thought that this was quite useful to mention here and could be used by teachers just to think about the kind of level that you could do at school from a simple point of view, and taking it further if you need to. So just very generally, making sure that you wipe down surfaces. Now, obviously, you're being very careful about doing that now with COVID. So we're talking about sort of pre, post, and during COVID as well, but thinking about with allergies. Clean pots and pans with soap and water. They say washing up liquids are fine, or use a dishwasher as this removes gluten. Use a clean oil or separate fryer for gluten-free foods. So if you're doing deep fat frying, make sure you're using a separate one. And then also for this one, because it's advice for cooking at home, they talk about a separate bread or chopping board. But for you at school, you'll be thinking about separate chopping boards. So your red, white, green chopping boards, not just one for bread. And then also for the advice on Coeliac UK, they talk about if you've got a butter dish, making sure that you have a separate one for people when they're having their toast in the morning and things, so they don't get cross-contamination. So the same thing for you at school would be to make sure that you had separate equipment ingredients, and it was washed up regularly, again, to prevent cross-contamination. And then also, so those are sort of some just simple ones. And we did actually, I mentioned it here, have a question in advance which talked about reusing containers for children who've got allergies. So these may be plastic ice cream containers or sweet boxes or something that you would send a finished dish home in. So whether they're safe to use with a child with allergies. If it is a mild allergy and it's thoroughly washed, it's probably fine. However, if it's a child that has a severe allergy, then don't reuse containers, buy new ones, use new ones each time. But again, it's important to find out from the parent exactly the level of hypersensitivity. And then we're talking about making sure that staff and learners are aware of the main 14 allergens. So Alex has talked about that, and I'll show you quite a nice way of being able to make people aware in a few minutes. Couple of things, well, just thinking about tasting and testing, same sort of thing as before, but just making sure that everybody's aware of the ingredients that are in the food provided for tasting and investigations. And then also, as always, when you're doing taste testing, make sure that there are clear guidelines and no double dipping or licking fingers, because what we don't want pupils to do is to double dip into a food and cross-contaminate it with bacteria, but also with allergens potentially. So on this slide, there is a link to the characteristics guide, the secondary one, if you wanted to have a look at that. So going back to record keeping, this is just thinking a bit more specifically about allergies and intolerances. So you might find that your school gathers the information by administration staff, and this is added to pupil records or SIMS. But certainly when I was teaching, what I did was I also contacted the parents directly myself. So at the beginning of every year, I sent out a letter to them just explaining about what their child would be doing in their food lessons, setting out a few rules, but then also asking them to identify any allergies or intolerances or any dietary requirements. And I then actually kept a note as well in my records. And then I could also cross-refer to what I had to what was on SIMS to make sure we both had the same information. And then with the information, I recorded it on my seating plan. So that's actually where the pupils are going to be sitting down for theory lessons, but also if they're going to be working in a practical area, actually identifying which pupil has an allergy, and then making sure that you can control that environment for them. And then also recorded on exercise books and booklets. So you've got lots of opportunity to keep being reminded, and for others to be reminded that there is a child with an allergy. And then it's important to make sure that these are updated at the beginning of the academic year, or change of rotation, or change of activity. So what do you need to know, so the school and you? So is it an allergy or an intolerance? So as Alex was saying earlier on, the allergy is the one that we're have to be absolutely particularly careful about because of the immediate impact and danger of that, and the fact that it could be fatal. But obviously you need to be aware of intolerance, because we want to make sure that the pupils are safe and well in our care, whether it's an allergy or an intolerance. If it is an allergy, if it's airborne, contact or ingested, because that will actually make a difference as to your management of the practical lesson and what equipment they can use, what recipes that you can do, whether you've got to think about perhaps adapting recipes to use different ingredients for the pupil, or whether if it's a severe allergy, whether you may need to change the recipe for the whole group or think about alternatives. So that's a really important thing to find out. And then also, what if any immediate action is needed if there's an adverse reaction or emergency. And if the pupil has a healthcare plan, that will be included in that. So I mentioned earlier on about making staff and learners aware of allergens, and the image that you can see there is something which I thought was absolutely fantastic when we went for a practical workshop at the Market Bosworth School a couple of years ago. So the technician there had taken the FSA allergen menu chart, and the link is on the slide, and they've actually had it copied onto a whiteboard. And then what happens is that at beginning of the week, the technician or the teacher would write on the board the recipes that were going to be made. Now, these were directed recipes, so the recipes that you tell the children, the pupils, that they're going to be making. And then for each recipe, the allergen would be identified, and that was put in a prominent place in the practical room so everybody could see it and everybody knew what allergens were in each of the recipes, which I thought was just brilliant. There are some resources on the website that will help the pupils do this themselves. So we've got a chef's recipe card up there, which is one, and then this one is an allergen menu planner, and both of these have been adapted from FSA resources. So, so they'd be quite useful to get the pupils starting to think about what the allergens might be in the recipes and just getting this general awareness of allergens. And so it's not just thinking about a particular pupil with an allergen, but making sure everybody is aware. And then also something else which I think is really important, and this I think is very good for just your general food safety management. So some of you may do this already, but it's producing labels for finished dishes. So whether this is something you make in primary school or in secondary school, and it helps control the management of your fridge, but also gives pupils and parents important storage, cooking and allergen information. So the label could contain name, date, class, year group, depending what's appropriate, cooking and storage instructions, and then also allergens. And then if you've got older pupils who are making their own recipes, so not one that you've directed, what I recommend is you produce some blanks of these that they can then fill out the details and then actually make sure that the information is on all of the food, the products that are made in school. Okay, so that's a little bit about the management in the classroom, but what I want to do is just go through just some pupil resources that we feel that you might find useful for that. And so this one is the allergen menu planner that I mentioned before. And then we've got another worksheet. I'm just going to run through these quite quickly because I'm just conscious of the time. And presentations, worksheets, quizzes. So these are Kahoot quizzes, but also online versions and paper versions. And then we've got another worksheet there. And then these are brand new, our knowledge organisers. Some of you may have seen that we've been producing these. So at the moment we've got 5 to 7, 7 to 11 and 11 to 14 knowledge organisers. And these are ones that would cover allergens. And we're hoping to have 14 to 16 available very shortly, next few weeks. So we've got healthy eating and cooking, and then in a few months' time we're going to have where food comes from and food commodities as well. So those can be printed off and given to pupils and used for knowledge retrieval. So just a little bit about other sources of information and support. So as I said before, there are a number of organisations that have got FAQs and other information that you can look at. And Food Standards Scotland have got some education resources which are good to have a look at. And Allergy UK also has a sort of a test, an online test that you can do so that you can have a look to see how allergy aware your school is. And they also have resources to help schools put together a good allergen management program or policy. And then just quickly before we finish, there may be some questions I think coming up. We've got some more training. So we've got a primary skill along, which is bred a couple of weeks' time, and then we've got some virtual practical food skills workshops. So our training is all online this year. So we've got some back to basics and some food skills and recipe progression, and another one in January, which is also, March, which is also food skills and recipe progression, but it's a slightly different one. So do have a look at those. It'll be great to see you. We're also going to have some regional virtual conferences, and more details will be coming soon. And we also have some online training, one of which you might find useful is the characteristics, the guide, which I was mentioning earlier on. We've actually got an online course which is based on, for secondary, there'll be a primary one coming soon, but it's based on those characteristics. So if you're new to teaching, then you might find that quite useful. We've also got a PPD information, a newsletter. So if you're not signed up for that, do sign up for that, and then you'll find out all about our training as and when it happens. So I think, if I'm right, we're there. So thank you very much. Alex will come back in just a minute and let me know if there are any questions, but he mentioned right at the beginning that we'll have this evaluation. Hopefully you should automatically be redirected to the evaluation when the webinar finishes. Sometimes it doesn't happen. So if you don't get directed to it automatically, please don't worry. We'll send you an email tomorrow morning, which will have the link to the PowerPoint and the recording on the website, and also the link to the evaluation as well. So thank you very much. Alex, do we have any questions?
Yeah, there's a few. I'm just going through them now, but I think a lot of them have been answered by other teachers on the chat, which is great.
Great.
I think that there's one about looking at food labels in the classroom. Is that the teacher's job to go through when they're purchasing food, to go through and check the allergenic ingredients on the food packages before they start using them?
Yes, I would suggest it was. Yes, if they're going to be used by the pupils. So if you're buying the ingredients for your school, your classes to use as part of that sort of purchasing and supply element, yes, it would be the teacher's responsibility just to have a look at the ingredients, just to double check that there aren't any allergens in any of the products that are being bought. So some of the ones that I think often catch people out are things like, or is it Leon Perrins? I think one of the sources has actually got anchovies in it, and that often catches people out. And obviously, anchovies are a fish, and they may cause an allergic reaction. So yes, I would say yes, it is a responsibility.
We've got one that's on slightly different to this. Is it possible to join a waiting list for the 10th of October practical lesson? Yes, there is the waiting list on the on Eventbrite. So if you go onto Eventbrite, then you should be able to join the waiting list. And I think that's it in terms of questions. So I think that's everything, Frances.
Thanks. I've just noticed actually, Alex, somebody's just said about, do you get a copy of the PowerPoint? Yes, what we'll do is we'll upload the PowerPoint to Food Effective Life with the webinar recording, and we'll send out an email tomorrow to everybody who's attended the webinar, and they can, which will have the link to the website and the evaluation as well. Okay, right. So is that it, Alex, do you think? That's all the questions?
Yeah, I think that's everything.
Brilliant. Right, well, thank you very much, Alex. That was really interesting, really informative. Thank you. And thank you, everybody, for joining.